A report shows the CMS hospital star ratings have been wrong for 2 years. Hundreds are tested for HIV after an Oklahoma nurse reused syringes. Veterans Affairs unveils the first rankings for its 133 nursing homes, and a former nursing home owner's every nickel is possibly at stake with class action ruling. This and more next.
You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning. Today is Wednesday, June 20th, 2018. The Centers for Medicare and Medicaid Services has miscalculated hospital star ratings for 2 years, according to a startling report published by Modern Healthcare on Friday. Reviewing its own data, leaders at Rush University Medical Center in Chicago found that CMS gave more weight to certain factors during different rating periods. The hospital said the formula relied heavily on a measure for patient safety and adverse events for the first 4 releases, and there shifted preference toward hip and knee replacement complications for the latest one. In each calculation, a lone measure accounted for about 98% of a hospital's safety performance, according to Rush. The safety category greatly influences a hospital's overall star rating. As in the skilled nursing world, star ratings are used by consumers and to help attract providers. Modern Healthcare reported computer modeling led to the miscalculation, and that other analytic experts had approached CMS with concerns about its use. Last week, CMS delayed the latest release of hospital star ratings until July, saying it was addressing, quote, stakeholder concerns. Modern Healthcare suggested Rush's findings, shared exclusively with it, prompted the postponement. The Cherokee Nation Hospital in Oklahoma is testing more than 180 patients for HIV and hepatitis after allegations that a nurse reused syringes to administer medications. Cherokee officials tell the Tulsa World that the nurse violated protocols by using the same vial of medication and syringe to inject multiple intravenous bags at W.W. Hastings Hospital in Tahlequah. Officials say the nurse no longer works for the tribe. Hospital CEO Brian Hale says it's unlikely blood-borne pathogens traveled into an IV bag to cause cross-contamination. The patients who were treated at the hospital between January and April are recommended to still return for blood tests. About 64 patients had been screened as of last week, none of whom tested positive. Officials are still working to notify 8 patients who should be tested. We'll be back right after this break. Rankings unveiled by the Department of Veterans Affairs for the first time this week allow consumers to compare 133 federally run nursing homes against thousands of privately operated ones ranked by the Centers for Medicare and Medicaid Services. Like Nursing Home Compare, the system uses a starred rating system, with 1 star being the worst and 5 being the best. Stars are awarded for staffing, quality, and survey performance, as well as overall performance. VA officials said they plan to update the rankings annually, saying the effort is a part of the department-wide focus on, quote, transparency and accountability. According to the internal data, 60 nursing homes improved from 2017, and 73 experienced no significant change in quality. One facility, the nursing home associated with the VA Black Hills Healthcare System in Hot Springs, South Dakota, dropped in quality during the past year, but still earned a 4-star rating. The VA released 1 to 5-star performance ratings for its medical centers last year after an investigation by USA Today found those ratings were being withheld, according to military.com. A New York judge has cleared the way for residents of a troubled nursing home to pursue a class action lawsuit against its former owners. Onondaga County Supreme Court Judge Anthony Paris agreed on Wednesday to certify the class, which would include more than 1,000 residents former residents or survivors of those who had lived at the former James Square facility since 2015. A suit brought by attorney Jeremiah Frey Pearson claims that the short staffing harmed residents, quote, some of whom were left lying in their own feces and urine for hours, according to Syracuse.com. He said, "We look forward to taking the former owners for every nickel," Frey Pearson told media gathered outside the courtroom. The facility had gained notoriety for several lapses in recent years, including a management shakeup in March, last August's resuscitation of a resident with a DNR, and Legionnaire's cases in 2017. The state attorney general's office raided the nursing home in June 2017 and seized records as part of an ongoing investigation into patient care. This has been your long-term care news update. Everyone have a wonderful week, and I'll see you on Wednesday.